Cancer Biomarker Testing, a Simplified Guide. Let's follow Dr. Lucas, a medical oncologist interviewed by Sofia, a journalist, discussing how biomarker testing can help fight cancer.
Dr. Lucas, during our previous interview, you explained the importance of identifying cancer mutations because they can serve as biomarkers. How can the identification of biomarkers impact a patient's journey?
Great question. Identifying biomarkers can really help us make more informed treatment decisions for our patients. This is important because patients with the same type of cancer can have different biomarker profiles, allowing us to tailor their treatment plans based on the specific biomarkers we identify.
Okay, I understand this will make the treatments more personalized. But how do you perform cancer biomarker testing on a patient?
Let me explain the procedure. We start by taking a piece of the tumor, which is called a biopsy. This tumor biopsy is preserved in a paraffin block, which is then prepared for the pathologist to examine the biopsy content under a microscope and confirm the diagnosis. Then we can extract the tumor's genetic material, DNA and RNA, from the biopsy to test for biomarkers. This helps identify the cancer biomarkers needed for making treatment decisions. Since some tumors' genetic material may be very limited, it can be helpful to obtain as much information as possible to avoid the need for rebiopsy.
What type of tests are used to identify cancer biomarkers?
There are different types of biomarker tests. Some tests focus on one biomarker at a time, known as single biomarker testing. This group includes immunohistochemistry, FISH, Sanger sequencing, and qPCR. Others can examine multiple biomarkers at once, known as multiple biomarker testing, such as NGS. When we test one biomarker at a time, we can get results quickly. If the results are informative, we don't need to conduct further testing. But if this first biomarker does not provide useful information, we keep testing until we find the biomarkers that can help us make informed treatment decisions. However, performing these tests one after another can deplete the tumor's genetic material and potentially extend the time required for diagnosis. Or we opt for a multiple biomarker NGS test, which allows for an efficient use of the tumor's genetic material. Using this approach, we can obtain the biomarker information simultaneously, getting comprehensive data for making therapy decisions.
In which situations would you request biomarker testing?
Well, every case is unique. In some situations, professional cancer societies recommend the use of single biomarker testing, such as the diagnosis of certain primary tumors, or when multiple biomarker testing is not available. Multiple biomarker testing is recommended in other situations, such as in advanced cancer and rare tumors.
What should you have learned from Dr. Lucas's interview? Identifying biomarkers helps doctors make better treatment decisions. There are two main types of tests to identify cancer mutations: single biomarker testing and multiple biomarker testing. Single biomarker testing delivers results one at a time, whereas multiple biomarker testing provides comprehensive results at once.
Thanks. I look forward to our next interview to learn out more about biomarker testing and its impact on specific tumor types.
If you want to watch the full video series on cancer biomarkers, scan the QR codes. In case you have any questions, please talk to your doctor. This video is for educational purposes only.